So how do you know you have hemorrhoids? Commonest presentation is bleeding. Okay, anytime they pass through, they bleed. They bleed, and some can bleed their bladder and become anemic. I mean, we have two people, gentlemen on our wards recently, that are anemic because of hemorrhoid, because every time they defecate, they lose blood. So bleeding is one of the things you use to know you have hemorrhoids. Another thing is itchy anus. Okay, that's also another symptom. Sometimes people have incontinence, they are not able to hold stool because the hemorrhoidal cushions are supposed to close the opening of the anal canal, so you don't keep losing stool or losing gas without your consent. So people can present with that. But one of the striking things people will tell you is that they see a protrusion coming out of their anus, and this protrusion may come out and not go back, or sometimes it comes back and go back by itself, or sometimes they have to digitally use their hand to push it back, so these things are telling you that you have hemorrhoids. Okay, and hemorrhoid by location, some of them are inside, you don't see anything come out. The only thing is that you have the symptoms of bleeding anytime you visit the washroom, and some are outside, they are external. Okay, so you should know that the various types, and sometimes it can be really painful when it is thrombosed. Okay, so that is hemorrhoid. Now when you have hemorrhoids, what do we do? Typically you come to the hospital and you are diagnosed, and the doctor may ask you to sometimes do a scan of your lower intestine. We call it colonoscopy or sigmoidoscopy or proctoscopy or whatever variant of scan. There should be a camera to check whether there is any cancer around the rectum or the anal area. Okay, once you have done that and they are clear that there are no cancer, then the treatment can be given to you depending on the stage that your hemorrhoid is in. Some of them, it's just about lifestyle modification. Drink a lot of water, don't postpone defecation, don't sit too much on the toilet bowl. When you finish, sit in a lukewarm water with salt, we call it sitz bath, and some of those changes could be helpful. Sometimes we give you something to insert in your anus, which may help, but sometimes you may need surgery, and this surgery sometimes involves cutting off the engorged blood vessels, or sometimes we can inject it, sometimes we can band it or tie it off, and all that. So you have various forms of treatment that is available for hemorrhoids. But the important thing for you to know is that if you have hemorrhoid, it's important to see your doctor and get diagnosed. Sometimes it could be a cancer that is presenting as such. Take care of yourself this year and always seek professional advice with your symptoms.